Hi, my name is Dr. Ayanna Bryan, PhD, and I'm the Senior Scientist here at Americord Registry. Today I'll be answering some questions we've been asked about the coronavirus or COVID-19 and how it might affect pregnancy, childcare, as well as cord blood banking. Now, the first question is, should I be more worried about contracting COVID-19 because I'm pregnant? And the short answer is yes. Pregnant women are more susceptible to viral infections because their immune systems are compromised or overloaded because you're building a baby. So you really do need to take the CDC guidelines and the FDA guidelines of health and safety around COVID-19 very seriously. So wash your hands frequently, don't touch your face, minimize your interaction with people outside of your immediate household, as well as wearing a mask when you go out, because you really should stay healthy and walk around. But, wear gloves when you go shopping, that kind of thing. And just make sure you keep safe and keep things clean around you. The next question is my baby at increased risk from COVID-19, and do I need to do anything differently than I was planning? Well, babies and children in general don't fully develop their immune systems until about 7 or 8 years old. So they are at risk of viral infection. So you really do have to be very careful and extend those CDC guidelines to your children. So limit the amount of people that are interacting with your baby, like restrict it to your immediate household if possible, for as long as possible. And even ensure that people wear a mask around them if they do see someone outside of your immediate household. Make sure everyone washes their hands before touching baby's things. And clean everything around baby. Babies will put their mouths on objects or put objects in their mouths, and you want to really limit the risk of exposure through touching surfaces that might have come in contact with coronavirus. So really just follow those guidelines and make sure everyone is safe around baby. The next question is, how does COVID-19 affect cord blood banking? Is it still safe? Yes, it is still safe. COVID-19 does not transmit through blood, so collecting cord blood is not going to risk getting COVID-19 into the blood or from the blood into anything else. So it is still as safe as it was. What has Americord been doing to make sure that cord blood banking is still a safe option? Well, we've been keeping in constant communication with our manufacturers, vendors, lab staff, courier, and CDC and FDA to make sure that everyone is on board and keeping in line with the guidelines of health and safety from a lab perspective, manufacturing perspective, that everyone is healthy, and that if there is even any risk of exposure, that it's isolated and dealt with quickly. Do I have to make any special arrangements to collect the cord blood now? I would strongly recommend that you keep your kit or get your kit early, keep it on hand, and bring it with you to the hospital so that we don't have to rush a kit last minute. That way, you're calm, everything is following a certain order, and there's not too many deviations from your plan, your birth plan. The only real thing that you need to plan for is that after baby's born and your doctor's done the collection, the courier might not be allowed to come up to your hospital room or even to the delivery floor. So you'll have to assign someone responsible for taking the kit from your hospital room to the hospital lobby or to the hospital doors to the courier themselves. So make sure you have a plan for that set up. And the next question is, can stem cells be used to treat coronavirus or other viral infections? If so, how does that work? Well, there has been a lot of research about stem cells in treating of respiratory disorders, from pneumonia to SARS, COPD, asthma, many types of disorders that have to do with viruses, inflammation, tissue damage, that kind of thing. And there's really two ways that would work. One would be attacking the virus with the use of stem cells and a pharmaceutical drug, or really managing the inflammation and the tissue damage that might happen due to viral infection. So there's those two routes of activity at this time. Now, none of that is ready yet, so please do not expect that you could store your stem cells and have that used as a treatment right away. Usually this takes several phases of clinical trial and probably 18 months. But right now it's a very hot and very hopeful area in stem cell research. And that's it for now. So as always, we're committed to making cord blood banking as safe and as effective as possible for you. So if you have any questions, please do not hesitate to reach out. We're always here and happy to help. Take care and stay safe.